Welcome to the OB-GYN residency program at DHR Health. We're proud to offer a comprehensive and dynamic residency program dedicated to training the next generation of obstetricians and gynecologists. Our mission goes beyond just practicing medicine. We aim to provide a well-rounded education and clinical experience, focusing not only on patient care, but also on areas like quality improvement, patient experience, informatics, leadership, education, and advocacy. Our residency offers diverse clinical experiences, including obstetrics, gynecology, reproductive endocrinology, maternal-fetal medicine, and gynecologic oncology. You'll gain hands-on experience managing a wide variety of cases, ensuring that you're a well-rounded and competent in all aspects of OB-GYN care. We believe that a positive, inclusive learning environment is essential for resident success. Our program fosters a culture of collaboration, mutual respect, and continuous learning, so you'll always feel supported on your residency journey. DHR Health is deeply embedded in the Rio Grande Valley community. As a resident, you'll have the unique opportunity to serve an underserved population while also experiencing the tremendous growth of this region. Through community outreach, health education, and volunteer programs, you'll make a meaningful impact on the health and well-being of those who need it most. We invite you to explore our OB-GYN residency program and discover the unique opportunities that await you. Today, meet our expert faculty who are dedicated to training you in the most critical specialties within women's health care.
As specialists in maternal-fetal medicine, we work with residents on managing high-risk pregnancies. Our goal is to train you to provide comprehensive care for mothers and babies facing complex conditions. From prenatal diagnostics to fetal therapies, you'll gain the hands-on experience needed to confidently navigate challenging cases.
Obstetrics is at the heart of what we do. We guide residents through a variety of deliveries, from routine to emergency cases. We focus on ensuring that you develop the technical skills needed to manage labor and delivery while always prioritizing patient-centered care. Together, we're bringing new lives into the world.
In gynecology, you'll be exposed to a broad spectrum of women's health issues, from preventative care to complex surgeries. We work closely with residents to build both clinical and surgical skills, ensuring you are prepared for everything from routine gynecological exams to treating advanced reproductive health disorders.
Our residency program also offers an exciting opportunity for an away rotation in complex family planning. During this rotation, you'll gain a specialized experience in providing care for patients with advanced family planning needs, ensuring you're well equipped to handle a range of complex cases and advocate for reproductive health care.
Here at DHR Health Women's Hospital, we have 3 dedicated Da Vinci Xi robots with dual consoles for teaching. Our minimally invasive surgery and robotics program does over 1,000 robotic cases a year of all complexity. And we are certified by the SRC as a recognized center of excellence in robotics and minimally invasive gynecological surgery, with several surgeons of excellence. We will offer a track to obtain your robotics certificate once you complete your training, allowing for confidence and skill after you finish.
These are just a few of the dedicated faculty members who will guide you through your residency at DHR Health. Our diverse clinical experiences, advanced training techniques, and commitment to innovation will prepare you to excel in every area of obstetrics and gynecology. We believe in creating a supportive, collaborative environment where residents feel empowered to learn and grow. At DHR Health, you won't just be trained, you'll be inspired to make a lasting impact on the future of women's health. We're getting ready to walk into labor and delivery. Labor and delivery is a 24-bed unit. We have 2 pods, one pod here, and then the second pod over there with 12 beds. We also have centralized monitoring where they can see the patient's charts. All of our labor and delivery beds are configured similarly to allow plenty of room and comfort for the patient who's in labor, but also for the people that are here with them, relatives and significant others. We have 8 fully equipped operating room units. 3 rooms have Da Vinci robotic apparatuses. The last 2 rooms we reserve for cesarean deliveries. At any given time, one of the rooms is always equipped for an emergency cesarean section. Crash carts and emergency carts are situated between the two pods. Similarly, we have another pod over here with 12 beds for labor and delivery. We have a brand new critical care unit that has 5 state-of-the-art beds. We're able to monitor and care for critically ill patients, not only obstetrical, but also gynecological. We opened this unit during the COVID era, and we took care of a lot of patients who were also pregnant and had COVID infections. Each room is equipped to do high risk and difficult deliveries as well. The critical care unit is a closed unit limited to our intensivists, our high-level specialists such as cardiologists and pulmonologists and urologists, as well as maternal fetal medicine. Our staff and previous residents have nicknamed this area the fishbowl. And the fishbowl is where residents and faculty and laborists work in order to provide rapid access. We have 11 OB/ED bays in where the nurses and the physicians will see their patients who come into the emergency room to rule out labor or if they're having complications of their pregnancy. These are the best trained nurses. They specialize in emergency care of the obstetrical patient. We also have full-time mid-level practitioners who also assist us in taking care of our patients. Many obstetrical patients require prolonged hospitalization. We have an antepartum unit which also has 12 beds with monitors. And this is where we care for patients with complex pregnancies such as premature rupture of membranes, severe preeclampsia, bleeding. This is the only hospital in South Texas that does VBACs as well as placenta accreta spectrum disorders. So we receive consults from all over the valley. We hold multidisciplinary meetings to discuss patients with complex pregnancies. At that meeting, we invite the maternal fetal medicine, the primary care physician, as well as blood bank, anesthesia, and any other subspecialists that we may need to care for that patient. Once the patient delivers and she has been recovered in labor and delivery, we transfer our patients to our maternity floor, postpartum floor. We have a total of 48 postpartum beds and 24 post-operative beds. Again, we employ the pod system where we have 12 rooms in every pod, and we have 4 of them for postpartum care. Most of the time, the pods are full first part of the week. And again, our rooms are modern, comfortable, and we make it as pleasant as possible for our postpartum patients. We have highly trained staff that not only cares for the postpartum patient, but also assists with lactation issues and occasionally even with behavioral issues. This is the main corridor for the hospital. At the end of the corridor, we have a full-service cafeteria run by Luby's. And currently we have a level 1 nursery, and our NICU is upstairs, run by the Driscoll Hospital. We have collaboration with Driscoll Children's Hospital, who helps with difficult deliveries. Welcome to the resident quarters. We have 8 sleep rooms where residents are able to come during a break and enjoy private quarters where they can rest, study, and do some of their chart work. This is a residence lounge. They can go to the cafeteria, bring their food here, and we also keep the refrigerator stocked for on-call personnel. Down this hall, we have perioperative care. We have 8 pre-op rooms reserved for our maternal patients. Each one of these bays has their own monitor, and these patients are continuously monitored upon arrival and before surgery. Here's where they're prepared for their procedure. On this other side of the nurse's station, we also have 8 other rooms that we also reserve for our gynecological patients who are going to have their hysterectomies or hysteroscopies or other gynecological procedures. We do approximately 400 gynecological procedures a month, as well as cesarean deliveries, repeat C-sections, cerclages, and DNCs over here. This is looking at our operative suites from the opposite side of the hall. There's a very comfortable doctor's lounge on the right side. Nurse's lounge is on the left. Since construction of this hospital, a lot of the gynecological procedures are minimal invasive surgeries. And so recovery is 6 to 8 hours. And once a patient meets milestones, they are discharged to home to be followed up in the office, usually 3 to 7 days later. We have 21 recovery beds, and all of our nursing personnel are trained to care for and manage post-gynecological procedures as well as obstetrical procedures. This is the waiting area for families of patients who are having procedures done. We have a conference room that is equipped audiovisually for meetings with residents. We do some of our grand rounds procedures here. Our M&M conferences and our multidisciplinary meetings are held here. Once again, thank you for joining us in this tour of Women's Hospital, a freestanding, full-service women's care facility. And we look forward to seeing more of you here at our facility as well.